And just to touch on the brain mapping, because you've mentioned that a couple of times in the episode so far, and you've performed thousands. I think they're called QEEG brain maps, like throughout your career. What has that taught you about a dysregulated brain?
Yeah. So just to understand what a brain map is, it's really simply, it collects, measures a surface electrical activity in the brain. And then what happens is you put it in a database, it gets analyzed, and it gives you a visual representation of the brain. And you can see what areas are overworking and underworking, right? So understimulation, overstimulation. I mean, I think the biggest thing that I see is overactivation. And what's cool about a brain map, you can actually see the structures, what's happening over the structure. So what's happening in your frontal lobes or your amygdala area, and then you actually can see brain communication. So how is the brain connecting? I always call those superhighways. So people are exhausted. And so what the brain communication, either most of the time is I call it jacked up, like in full activation. But for adults a lot, the other side of overactivation is shutting off. And so you see areas where things are just turned off because they've run out of gas. And so more than anything, I see just exhausted brains that have a lot of inflammation, a lot of activation, and those, and when you start regulating, you really get to see that change.
And throughout all of these brain maps, is there common brainwave patterns you tend to see with children, ADHD, anxiety, and autism, like differences in what would be perceived as a normal brain activity?
So when I sit down and look at a brain map, and honestly, in 30 seconds, I could tell you exactly what's going on. So again, I'm very unusual in the sense that when you've done this many brain maps, just like anything else, if you were a cardiologist and you'd done 10,000 heart surgeries, you're going to have a totally different experience than somebody who's done 100, right? Mm-hmm. So, and it's also just a very intuitive process. And anything I do level 10 geek. It's just the way that I am. Like I'm all in on anything. Mm-hmm. So when you're seeing brain maps, it becomes very clear what ADHD is. It's very clear for me when somebody has Lyme disease, tick-borne illness. I actually could tell the difference between viruses and bacteria in a brain. That's how clear I got it. I could tell when you had gut dysbiosis. And whenever I saw a medical condition, by the way, I referred you to the appropriate medical provider to get medical treatment to resolve. But the brain, what happens in ADHD, of course, you see ADHD brains show a mix of activation. They show areas of understimulation, they show areas of overstimulation, but always their frontal lobes, they're missing some gas. They're really missing the power to power up. They show a lot of very unfocused brain waves, and they show an absence of focused brain waves. I mean, that's just the standard. And we know through research that it's 89% accurate in diagnosing ADHD versus standard behavioral rating scales, which are between 37 and I believe 42% accurate. So quite a difference in how accurate they are. Most people are like, wow, autism shows an incredible amount of neuroinflammation. I mean, the greatest levels of neuroinflammation I've ever seen have been in brains with kids with autism and PANS-PANDAS, which is a disease where there's a misdirected immune response and infectious or toxin trigger causes the brain to produce incredible amounts of inflammation. And then there's neurocognitive and neuropsychiatric symptoms. I could do a whole other talk about it, but it's become increasingly common across the globe. UK is very much recognizing it. They were like staunch against it, but there's everyone's realizing, and this isn't just affects kids, it also affects adults too. So if anybody ever has a sudden onset after a tick, COVID, any infection, any toxic mold, you probably have PANS and PANDAS and you need to find a provider. But there's distinct patterns in all of those. And then, of course, because I was a clinician, I would then do a clinical intake to rule out certain things. Certain brain patterns, for example, concussion, head injury, birth trauma. There's nothing else that could be. Like when you see it, you're like, tell me what happened. And people will say, oh, I don't know. I don't remember. And then I would dig in. And they'd be like, oh, yeah. Literally true story. I jumped off a roof and into a pool. And but I didn't pass out. and I'm like, but you had something right here. Oh, yeah, I went to the hospital, but it was fine. And I was like, when did your real problem start? And they were like, oh my gosh, about 6 months later. It's like, okay. So it's a great diagnostic tool, and it's a great measurement tool to whatever treatment we did, whether it was everything from a gluten-free diet to PEMF to neurofeedback to different forms of psychotherapy. I've even done pre and post for Qigong. I mean, it's objective data, which is lovely to have. It's not necessary, right? I love to see what are the changes actually happening and being really specific, not like, oh, I'm no longer depressed. It's like, I'm no longer having a hard time getting up in the morning, or I'm able to get up within 30 minutes, right? And measuring because we have an all or nothing mentality in the world. You have to get really specific about the behaviors you want to see so your brain can recognize the positive changes.
No, it's really interesting you say that, actually, because, with PEMF therapy, it's a very passive therapy. So it's quite difficult to show someone physically what is the difference between using PEMF and after, before and after. And we've used methods in the past like dark field microscopes, looking at the blood activity and the cell activity before and after PEMF. But you mentioned about using the brain map, so doing pre and post PEMF therapy with the brain map. So what exactly are you seeing? Are you doing these like within half an hour of each other, or are these like a few days or months?
No, months. So, I'm no longer doing this, but we had a 6-month program where we do, and I've done all kinds of variations outside of the 6-month program, but I like months to go by, right? So at least 3 months, sometimes it's 6 months. I've even done 8 months later or a year later. And some people love to have it, but that clear data, sometimes, when you talk about labs, sometimes we measure cortisol. Sometimes we measure insulin levels, right? Because cortisol and insulin are related and people can have hyper levels of both. And you don't have to have these things. But man, I'm a data nerd, and my people loved data. They loved to see the difference. Now, I had lots of people who just buy PEMF. So when I always say, what are the 3 things you want to change? I had people who bought PEMF solely for constipation that was like related to stress. Like it was clear it was related to stress. They ruled out everything else. And stress is behind, they estimate about 70% of all medical visits are stress related. I think that's even an underestimate. So just even for yourself, you're doing PEMF. What do you want to do? You pick 3 micro behaviors, right? I want to sleep better. What does that mean? I want to sleep more than 6 hours. Okay. Right. Monitor it and then really keep track of it, because often when we're in such a state of dysregulation, it's really hard to see positives because our brain is wired to see negative. So people would say things to me over the years like, I don't see anything. And I'd say, oh, let me look at the behavior charts. And I'm like, oh, we have a 50% improvement. And they'd be like, what? And I'm like, yeah, look at where you started. So, really, really focus on the micro and look forward to that. But you're right, it is a passive thing. My husband is like such a happy guy. Like when I've put him on like every single thing you could think of, like Alpha Stim, this, that, whatever. And he's like, I don't feel anything, right? But he does it, and with PEMF, he goes, I feel nothing because I feel very chill from it, like the moment I use it. And, but what he notices is like, he'll sleep better. He'll notice. So he's a real fit, buff guy. He's that guy that, like people are like, what do you do to work out? He's super buff, right? He works out like an hour to 90 minutes a day, lifting weights. And he notices that he can work out better without pain to his muscle, because when you're working out that much and you're in your 50s, you're going to feel it. So he even just had an injury water skiing. And I just said to him, I was like, what do you think? And he's like, well, I'm healing I'm healing rapidly than they expected. So it's got to be doing something. So just see the possibilities instead of saying the negative, it's not doing anything. Because when you're saying the negative, your brain is going to believe it. So you say, I always say, if you're not feeling it, say, oh, I look forward to this working. I'm so excited about it. It is incredibly powerful to the brain.